Coronary care unit. Your patient is a 70-year-old who presented to the emergency department last night with chest pain, nausea and vomiting. An ECG and blood test showed evidence of a mild myocardial infarction. The cardiologist recommended an angiogram to be performed, but the patient feels anxious and unprepared. The attending cardiologist has asked you to explain the procedure and associated risk to the patient. Now let's look into the task. First one says, ask the patient about his concerns. Second one says, explain the angiogram is the best way to know the condition of the arteries and to check for any blockages. Third one says, briefly explain what is angiogram procedure, rays taken to see the heart vessels in detail. Sedation given, catheter is usually placed in the wrist or groin and guided into the heart. Fourth one says, rays taken to see the heart vessels in detail. Fifth one says, reassure and explain the complications are rare. Reaction to die, stroke, cardiac arrest or death. The last one says, accept that the patient wants to seek another opinion before having the angiogram. Now let's begin the role play. You can start like, hi, good morning Mr. Ram. I'm the registered nurse working in this coronary care unit. You look a little upset today. May I know what is troubling you? Then interlocutor may respond saying, good morning nurse. Yes, as you know that I've been admitted here last night because of chest pain, nausea and vomiting. So I'm really worried about my condition. Then respond him saying, I completely understand your condition Mr. Ram. Please don't be worried too much. You are at the right place and we are here to help you. Then interlocutor may agree with that. Then continue by saying, as you have been informed, your blood test and X-ray reveals an evidence of myocardial infarction. Therefore, your doctor has recommended an angiogram for you. Do you have any idea about the procedure? Then interlocutor may tell you like, no nurse, I do not have any idea about it. Moreover, I am really scared. Apart from that, I've never done these kinds of procedures before. Please let me know why should I undergo this procedure? Then respond him saying, I can sense how depressed you are. Mr. Ram, please relax. As the doctor confirmed, the procedure is really mandatory. As I've already mentioned, your blood test and other investigations confirm the myocardial infarction. Let me explain you the condition in detail so that you'll get a better idea. Is it okay with you, Mr. Ram? Then interlocutor may agree with that. Then continue by saying, a myocardial infarction, which is commonly known as a heart attack, this is a dangerous condition that happens because of lack of blood flow to your heart muscles. This can occur due to many different factors. However, it is usually related to the blockages in one or more of your heart arteries. Therefore, you need to undergo an angiogram. Angiogram is a procedure that uses X-ray imaging to see your heart vessels in detail. The test is generally done to see if there are any restrictions or blockages in the flow of blood to the heart. Therefore, it is highly important for you to undergo the procedure in order to understand the blockages in your arteries. Okay, Mr. Ram, I hope you understand the seriousness. Then interlocutor may respond saying, yes, nurse, I understand that. Can you please let me know how you are going to perform it? Then respond him saying, I can sense your feelings, Mr. Ram. Don't be overly concerned. Let me explain you that in detail. During coronary angiogram, a type of dye that is visible by an X-ray machine is injected into the blood vessels of your heart. During the procedure, a catheter will be inserted in the wrist or groin and guided to the heart with a small camera attached. The X-ray machines then takes a series of images which show the details of your blood vessels. So this procedure helps the doctor to open clogged heart arteries by angioplasty. But don't be worried too much because this procedure is not painful because you will be under sedation. Okay, Mr. Ram, I hope you are following me. Then interlocutor may ask you like, yes, nurse, would you like to tell me if it is a complicated procedure since you told me that you would sedate me? Then respond him saying, your worries are completely understandable, Mr. Ram. Yes, there are some mild and rare complications such as reaction to dye, stroke, cardiac arrest or death. But don't be upset. Our hospital is equipped with all the necessary equipment and has well-experienced staff and doctors. Moreover, we have never encountered such complications with any patients before. So I can assure you that you are in our safe hands. Okay, Mr. Ram, are you ready for the procedure? Then interlocutor may ask you like, okay, nurse, I'm a little confused now. It would be helpful for me to have a discussion with my family before the procedure. Could you please let me know if this is okay with you? Then respond him saying, that is a reasonable question, Mr. Ram. it is a good idea to have a second opinion before the procedure. So you can discuss the procedure with your family or anyone else and let us know the outcome. So this will allow us to perform the angiogram as soon as possible. Do you have any other question, Mr. Ram? Then interrogate me till you like notice. Thank you so much. Then you can wind up by saying, okay, Mr. Ram, I would like to summarize what we have discussed until now. We have been discussing angiogram procedure and its importance. I hope I was able to clarify all your concerns. If you have any more questions or concerns, you can just ring the buzzer. I'll be here to assist you. Thank you, Mr. Ram, for your valuable time. I wish you a speedy recovery. Thank you, guys. Our role play ends here.